Hi, I am Dr. Sudipto Pakrasi from the Vedanta Hospital. I will be showing you today the use of the LenSx and the Varion. Now, I've got this GoPro camera on my head, which I will be able to show you how this machine works. We have to do the right eye of this lady, so we press this. Once we press that, this is the plan which is coming out. It is also showing me the primary and the secondary incision site and where the arcuate cuts are going to be made by the femto. Here we have the centration and the capsulotomy center. We can actually press this to now know that we are doing LenSx internal, intrapupil, preopupil, limbus or visual axis. We tend to do the intrapupil, and once we select that, we then upload the patient. All the information will come there. Now I have pressed it, it's automatically come. So in this, what we do next is we press the program button, press the file. This will tell you what's the name and the date of birth of the patient, who is the surgeon, which eye has to be done. When we press the file, we open a file which we have put normal parameters of what we would like to do. We are now waiting for a pre-doc image on the Varion. So what this is going to do is to take the picture of this and expose the eye. We are going to wet the eye, the cornea, with a little bit of a drop. This is a circle which actually would be at the level of the limbus, which we have to get the eye limbus into that circle, and we press this spoke button here to get this into focusing, which is happening now. The moment it happens, you'll see an image will be registered and we get this diagnostic to pre-doc registration happening there. So what we do is, we have got an image, the high resolution image. This is now confirmed that this image is the same eye, and now what is going to do is to wait for the doc image. The next step we take, this is the patient interface. This one goes into the suction receptacle here. The yellow light will change into green. We will then put this patient interface clicked into position like this. We are going to press the dock button on the bottom right. Once this is pressed, my cornea comes into focus. It is going to focus itself onto the cornea automatically. Now we are lowering this and getting the PI onto the patient's cornea, and you will see a layer of fluid coming into the contact lens interface. Please press the suction. You have an immediate docking. We get this back into the green zone, after which we press this button all over again to focus and take another picture. Now we have got this image transferred to the Varion, registered. So what we're going to do is, it says registration done. I'm going to confirm that image. It says registration is successful. That means there's been not much change in the torsion of the eye. It's counterclockwise 4 degrees, and that's what we are now going to confirm, and this is going to send the image to the LenSx machine. It automatically corrects itself. So what, and scan the button. This is for the live OCT, which will come in the screen on this part, and there we are. That's a delta up, that's a delta down. This is showing that the entire anterior lens surface is now well covered. I'm going to accept it and then move on into the cornea, where we have, that's the area which will be in my safe zone. So I know I can actually push this position a bit back, but I've got this my fair amount of clear zone at the back where the laser will not penetrate into the posterior capsule. So I'm going to accept this now, and once I accept it, it will now go into the corneal thickness here. The corneal thickness is a primary incision which I will make, and that, once I press this, it shows me the way the incision is to be made by me. I am going to accept this and go into the arcuate thickness button, which will give me the depth and the positioning of the arcuate cuts, which will be conducted by the femto. I am going to accept this, make sure that my tab is in the green zone. I will verify and accept it, and then once I do that, I turn to the main machine, I apply it to the patient, and then the treatment will come on. The moment that comes on, my laser is ready. After which I have to put down my foot here. This will press the laser machine on, and let us see how that now works. Now the laser is on. You will see a pink bar going up as the capsule is being cut here in this area. Now this pink bar having gone up, the entire capsule is cut. Now we are cutting the cataract from down up. These are the vertical cuts, that's a horizontal, again the vertical. They are cutting it into small cubes, and then again you will get a horizontal wave, and then the final vertical. So there are 3 layers of vertical separation by having 2 layers of horizontal separations. There's the arcuate 1, arcuate 2, there's a main incision, the primary incision. Look at these air bubbles coming up. It's stopping just short of the limbus, and that's your secondary incision. At the end of which, you release your foot switch, you press this button, get this thing off. You have to then undock from the patient's eye, which you will see that the suction cup is now coming off. Unscrew the PI, and the patient is now fit to get up and walk into the laser, from the laser room into the phaco room.
Thank you, doctor.
You're welcome, ma'am.